I'm happy, I'm pleased to see the Supreme Court put the rule of law ahead of partisanship and ruled that the Affordable Care Act is constitutional. Now, Mr. President, it's a long opinion, and we know that when we come back here after the elections, there may be some things we need to do to improve the law, and we'll do that working together. But today, millions of Americans are already seeing the benefits of the law that we passed. Seniors are saving money on their prescriptions and checkups. Children can no longer be denied insurance because they have a pre-existing condition, a protection that will soon extend to every American. No longer will American families be a car accident or heart attack away from bankruptcy. Mr. President, I just had, every Thursday, I have a welcome to Washington. Today they had a group of people from Nevada who have or have relatives that have cystic fibrosis. It's been so hard for these young people to get insurance. It's not going to be that way anymore, Mr. President. No longer will Americans live in fear of losing their health insurance because they lose a job. No longer will tens of millions of Americans rely on emergency room care or go without care entirely because they have no insurance at all. Soon, virtually every man, woman, and child in America will have access to health insurance they can afford and the vital care they need. Passing the Affordable Care Act was the greatest single step in generations toward ensuring access to affordable, quality health care for every person in America, regardless of where they live or how much money they make. Mr. President, unfortunately, Republicans in Congress continue to target the rights and benefits guaranteed under this law. They'd like to give the power back to the insurance companies, the power of life and death back to the insurance companies. But our Supreme Court has spoken. The matter is settled. No one thinks this law is perfect. The presiding officer doesn't. I don't. But Democrats have proven we're willing to work with Republicans to improve what other problems that exist in this law, or in fact any other law. Millions of Americans are struggling to find work today, and we know that. Our first priority must be to improve the economy. It's time, though, for Republicans to stop refighting yesterday's battles. Now that this matter is settled, let's move on to other things, like jobs.
Today's decision makes one thing perfectly clear. Congress must act to repeal this misguided law. Obamacare has not only limited choices and increased health care costs for American families, it has made it harder for American businesses to hire. Today's decision does nothing to diminish the fact that Obamacare's mandates, tax hikes, and Medicare cuts should be repealed and replaced with common sense reforms that lower costs and that the American people actually want. It is my hope that with new leadership in the White House and Senate, we can enact these step-by-step solutions and prevent further damage from this terrible law.
Hello, I'm John Boehner. As you know, the Supreme Court recently issued its opinion on the President's health care law. I respect the Supreme Court's decision, but that doesn't mean that you and I have to accept Obamacare, which is raising health care costs and making it harder for small businesses to hire new workers. The only way to change this is by repealing Obamacare in its entirety. As a former small businessman, I understand that all the tax hikes, the mandates, the reams of regulations in Obamacare, they're creating massive uncertainty for job creators, leading them to sit on their hands. The House has passed more than 24 bills to defund, dismantle, and repeal Obamacare, and we won't let up until it's repealed in its entirety. And so get involved at teamboehner.com. Learn what you can do to help our House Republican majority reduce health care costs and get our economy moving again.
When we passed the Affordable Care Act and the President signed it into law, since then, tens of millions of people in our country are already benefiting from the legislation. As you know, as the President said so eloquently, children can no longer be denied coverage due to pre-existing condition. Young people, children and students and young people can stay on their parents' policy until they're 26 years old. Seniors are paying less for prescription drug and have access to free wellness and preventive visits. When the bill comes into effect, being a woman will no longer be a pre-existing medical condition. It's a victory for women. It's about wellness. It's about prevention. It's about the health of America, not just the health care. It's pretty exciting. Earlier this morning, I met with our caucus after the decision was announced. It was, as you know, no surprise to us. We knew that we thought that we were on solid grounds in terms of interstate commerce, solid grounds in terms of the Constitution. It was just a question of what the vote would be. And with that confidence, we happily embraced the decision that came down. Now we can move forward to the full implementation of the law, and when that happens, for the American people, the best is yet to come.
As you might imagine, I disagree with the Supreme Court's decision, and I agree with the dissent. What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday, it's bad policy today. Obamacare was bad law yesterday, it's bad law today. Let me tell you why I say that. Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations. Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep. Obamacare is a job killer. Businesses across the country have been asked what the impact is of Obamacare. 3/4 of those surveyed by the Chamber of Commerce said Obamacare makes it less likely for them to hire people. And perhaps most troubling of all, Obamacare puts the federal government between you and your doctor. For all those reasons, it's important for us to repeal and replace Obamacare. What are some of the things that we'll keep in place and must be in place in a reform, a real reform of our healthcare system? One, we have to make sure that people who want to keep their current insurance will be able to do so. Having 20 million people, up to that number of people, lose the insurance they want is simply unacceptable. Number two, got to make sure that those people who have pre-existing conditions know that they will be able to be insured and they will not lose their insurance. We also have to assure that we do our very best to help each state in their effort to assure that every American has access to affordable health care. And something that Obamacare does not do that must be done in real reform is helping lower the cost of health care and health insurance. It's becoming prohibitively expensive. And so this is now a time for the American people to make a choice. You can choose whether you want to have a larger and larger government, more and more intrusive in your life, separating you and your doctor, whether you're comfortable with more deficits, higher debt that we pass on to the coming generations, whether you're willing to have the government put in place a plan that potentially causes you to lose the insurance that you like, or whether instead you want to return to a time when the American people will have their own choice in health care, where consumers will be able to make their choices as to what kind of health insurance they want. This is a time of choice for the American people. Our mission is clear. If we want to get rid of Obamacare, we're going to have to replace President Obama. My mission is to make sure we do exactly that we return to the American people the privilege they've always had to live their lives in the way they feel most appropriate, where we don't pass on to coming generations massive deficits and debt, where we don't have a setting where jobs are lost. If we want good jobs and a bright economic future for ourselves and for our kids, we must replace Obamacare. That is my mission, that is our work, And I'm asking the people of America to join me. If you don't want the course that President Obama has put us on, if you want instead a course that the founders envisioned, then join me in this effort. Help us. Help us defeat Obamacare. Help us defeat the liberal agenda that makes government too big, too intrusive, and that's killing jobs across this great country. Thank you so much.
Earlier today, the Supreme Court upheld the constitutionality of the Affordable Care Act, the name of the health care reform we passed 2 years ago. In doing so, they've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin. I know there will be a lot of discussion today about the politics of all this, about who won and who lost. That's how these things tend to be viewed here in Washington. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. And because this law has a direct impact on so many Americans, I want to take this opportunity to talk about exactly what it means for you. First, if you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance. This law will only make it more secure and more affordable. Insurance companies can no longer impose lifetime limits on the amount of care you receive. They can no longer discriminate against children with pre-existing conditions. They can no longer drop your coverage if you get sick. They can no longer jack up your premiums without reason. They are required to provide free preventive care like checkups and mammograms, a provision that's already helped 54 million Americans with private insurance. And by this August, nearly 13 million of you will receive a rebate from your insurance company because it spent too much on things like administrative costs and CEO bonuses and not enough on your health care. There's more. Because of the Affordable Care Act, young adults under the age of 26 are able to stay on their parents' health care plans, a provision that's already helped 6 million young Americans. And because of the Affordable Care Act, seniors receive a discount on their prescription drugs, a discount that's already saved more than 5 million seniors on Medicare about $600 each. All of this is happening because of the Affordable Care Act. These provisions provide common sense protections for middle-class families, and they enjoy broad popular support. And thanks to today's decision, all of these benefits and protections will continue for Americans who already have health insurance. Now, if you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from. Each state will take the lead in designing their own menu of options. And if states can come up with even better ways of covering more people at the same quality and cost, this law allows them to do that too. And I've asked Congress to help speed up that process and give states this flexibility in year one. Once states set up these health insurance marketplaces, known as exchanges, insurance companies will no longer be able to discriminate against any American with a pre-existing health condition. They won't be able to charge you more just because you're a woman. They won't be able to bill you into bankruptcy. If you're sick, you'll finally have the same chance to get quality, affordable health care as everyone else. And if you can't afford the premiums, you'll receive a credit that helps pay for it. Today, the Supreme Court also upheld the principle that people who can afford health insurance should take the responsibility to buy health insurance. This is important for two reasons. First, when uninsured people who can afford coverage get sick and show up at the emergency room for care, the rest of us end up paying for their care in the form of higher premiums. And second, if you ask insurance companies to cover people with pre-existing conditions but don't require people who can afford it to buy their own insurance, some folks might wait until they're sick to buy the care they need, which would also drive up everybody else's premiums. That's why, even though I knew it wouldn't be politically popular and resisted the idea when I ran for this office, we ultimately included a provision in the Affordable Care Act that people who can afford to buy health insurance should take the responsibility to do so. In fact, this idea has enjoyed support from members of both parties, including the current Republican nominee for president. Still, I know the debate over this law has been divisive. I respect the very real concerns that millions of Americans have shared. And I know a lot of coverage through this health care debate has focused on what it means politically. Well, it should be pretty clear by now that I didn't do this because it was good politics. I did it because I believed it was good for the country. I did it because I believed it was good for the American people. You know, there's a framed letter that hangs in my office right now. It was sent to me during the health care debate by a woman named Natoma Canfield. For years and years, Natoma did everything right. She bought health insurance, she paid her premiums on time, but 18 years ago, Natoma was diagnosed with cancer. And even though she'd been cancer-free for more than a decade, her insurance company kept jacking up her rates year after year. And despite her desire to keep her coverage, despite her fears that she would get sick again, she had to surrender her health insurance and was forced to hang her fortunes on chance. I carried Natoma's story with me every day of the fight to pass this law. It reminded me of all the Americans, all across the country, who have had to worry not only about getting sick, but about the cost of getting well. Natoma is well today, and because of this law, there are other Americans, other sons and daughters, brothers and sisters, fathers and mothers, who will not have to hang their fortunes on chance. These are the Americans for whom we passed this law. The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can. But what we won't do, what the country can't afford to do, is refight the political battles of 2 years ago or go back to the way things were. With today's announcement, it's time for us to move forward, to implement and, where necessary, improve on this law. And now's the time to keep our focus on the most urgent challenge of our time, putting people back to work, paying down our debt, and building an economy where people can have confidence that if they work hard, they can get ahead. But today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward. Thank you. God bless you, and God bless America.